Here at Riverside Family Medicine, we have an amazing group of faculty that are fully dedicated to supporting our residents through 3 busy years of family medicine residency education. The next few minutes of this video, we're going to go through all of our full-time and part-time teaching faculty, and they'll each get an opportunity to tell you a little bit more about their own roles here at the program. I'd like to start with our full-time teaching faculty. I'll start with myself. My name is Steve Osceola. I am the program director here at Riverside Family Medicine. I did my residency training here at this program, graduated in 2016 and joined the faculty. I did my medical school training at the West Virginia University School of Medicine, and I did my undergraduate training at The Ohio State University. I took over as program director in 2019, and I do a little bit of everything here at the program. I do work with our residents both in the inpatient and outpatient setting, as well as on our Wellness on Wheels community outreach unit. I have several areas of interest, including community outreach, physician leadership development, and wellness. I really love doing and teaching skin and soft tissue procedures and working with residents on those. And my favorite clinical aspect to teach is the bread and butter of family medicine, the stuff we do every day that we need to make sure as family docs we do really, really well.
Hi, I'm Joe Ginty. I'm the Associate Program Director here at Riverside Family Practice Program. I joined the faculty full-time in January 2019. I completed my residency at Riverside in 1993 and joined a practice in Lancaster, Ohio. There I took newborn call, ICU call, and practiced the full spectrum of family medicine other than OB. Here at the office, I'm responsible for the practice management curriculum. I work with the second and third years, preparing them for entry into the real world. I also run the billing and coding curriculum. I serve as the Family Medicine Clerkship Site Director for Toledo College of Medicine. I look forward to having a chance to meet you soon.
Hello everyone, I'm Ann Ehring. I'm one of the Associate Program Directors here at Riverside Family Practice. I started as faculty in 1997. I did my undergraduate at Bowling Green State University and went to the Ohio State University for medical school. Came here for residency and then worked in private practice for a couple years and was recruited to come back to faculty. I wear many hats here in the office. What I liked to do the best is women's health, including OBGYN and one of the 2 OB providers here in the office. I also do a lot of pediatrics, and I also do a lot of addiction medicine. I'm one of the Suboxone providers here in the office. So again, welcome, and we're glad that you're interested in our program.
Hi, my name is Dr. Melissa Jeffress, and I'm Associate Director here at the Residency Program, and also Medical Director of Riverside Family Practice Center, which is the clinical site for Riverside Family Medicine Residency Program. In addition to serving for those 2 roles, I also spend part of my time in clinical informatics and am a physician envoy for Care Connect. So Care Connect is our version of Epic, which is our EMR, and I spend some of my time programming Epic. A little bit about my background. I did my undergraduate at University of Pittsburgh and majored in computer science, which is very useful in the clinical informatics space. I came to Ohio State for medical school, did residency at Ohio State, and then joined the faculty here at Riverside in 2010. In addition to being board certified in family medicine, I'm also board certified in clinical informatics. Some things that I'm involved with in the curriculum here is I do both inpatient and outpatient precepting. Definitely have lots of experience in use of the EMR and can help the residents learn how to use the EMR better in their practice. I am one of the Suboxone providers, so I do some medication-assisted therapy, mainly leading the Thursday afternoon medication-assisted therapy clinic. There's lots of QI initiatives that are always happening in the office here, so definitely involved in those, and also involved in a lot of different rotations as far as their involvement within our office. A couple other interests of mine is I've been involved in a lot of national and local organizations from an advocacy perspective, and I feel it's really important for our specialty and medicine and for our patients to be able to advocate at both a local and a national level. Also interested in social determinants of health and figuring out how we can help our patients, and how these affect their life and their ability to maintain their health, and working with our office to kind of solidify some of those processes. And then also working on procedural skills. So hope to meet all of you soon. Thanks.
Hi, my name is Sarah Vangel. I use she, her pronouns. I'm the Assistant Program Director here at Riverside Family Medicine, as well as with the Primary Care Sports Medicine Fellowship. I also serve as the head team physician for Kenyon College, Go Owls. And here at Riverside, I run the sports and MSK curriculum, the POCUS curriculum, our sports clinic that we have in-house, as well as I serve as one of our many inclusion champions. I have many interests within family medicine, but my specific roles within our program are MSK ultrasound, adolescent health, preventative health, diversity inclusion, and physician wellness.
Hi, my name is John Montemayor. I'm an assistant program director here at Riverside Family Medicine. I graduated from this program in 2019 and joined faculty back in July of 2019. I'm a graduate from the medical school at The Ohio State University. A few of my roles in the program, I do a lot of precepting on the inpatient and outpatient side of our practice. I'm also heavily involved in the simulation curriculum. I am developing a medical Spanish curriculum as well, and hopefully developing an elective for advanced and intermediate speakers. I also work with the Wellness on Wheels community outreach and work with our longitudinal resident precepting out there. I'm also involved with the medical students and work closely with our OSU and sub-I clerkships. A few of my interests include technology in medical education, as well as diversity and inclusion, Latinx health, and community outreach. Bienvenidos.
Hi, my name is Emily Gorman. I'm one of the assistant program directors here at Riverside Family Medicine. I attended the University of Dayton for my undergraduate degree, majoring in biology with a minor in Spanish, and I then went to Ohio University Heritage College of Osteopathic Medicine for medical school. I attended the Athens campus and my clinical rotations were here in Columbus. I completed my family medicine residency here at Riverside and served as chief during my senior year. I then joined faculty in 2019. My specific interests within family medicine include women's health and maternal care, dermatology, and osteopathic medicine. I see patients in the prenatal clinic as well as for their postpartum visits. For dermatology, I lead our curriculum, and I'm excited that our residents have the opportunity to participate in the dermatology consult service at the hospital. Lastly, we've made some amazing additions to our osteopathic curriculum, including a 4-week elective for our residents, which is led by myself. In regards to my use of OMT in the patient care setting, I have one dedicated half day for manipulation, and I also frequently use it during my routine patient schedule. I've completed 2 osteopathic cranial manipulation courses, and I've been able to apply this training in multiple patient care scenarios, but I have a special passion for treating patients with headaches and infants with feeding difficulties.
Hi, my name is Allison Gase, and I'm one of the assistant program directors at Riverside. I went to medical school at Ohio University, the Dublin campus, and completed my residency training here at Riverside. I served as a chief resident and joined faculty in August 2021. I feel very fortunate to have trained at this program, and I'm now excited to contribute as faculty through serving as a preceptor in both the ambulatory and inpatient settings. I am involved in the Food is Health program and also work with Dr. Middleton on our scholarly activity population health curriculum. My main interests within family medicine include behavioral health, pediatrics, nutrition, and population health. We're so excited you're interested in our program and look forward to learning more about you.
Hi, my name is Jasmine Edwards. I attended medical school at Wright State University Boonshoff School of Medicine. I am currently a third-year resident here at Riverside Family Medicine. Additionally, I serve as one of the co-chiefs this year. I am so excited to be joining faculty next academic year as one of the assistant program directors.
We are actively recruiting a new behaviorist after the retirement of our longtime behaviorist, Jim. We've interviewed several excellent candidates, and we hope to have this position filled within the next month or two. In addition to our full-time faculty, we have several part-time faculty that serve important roles at the program.
Hi, I'm Dr. Lori Hamama. I'm one of the Associate Program Directors here at Riverside Family Medicine. I have another role at Ohio Health, and that's the Medical Director of Provider and Associate Wellbeing. But at Riverside Family Medicine, I'm a proud graduate, served as Chief Resident, and was Program Director here as well. So very dedicated to education and improving the resident experience within graduate medical education. My clinical interests include pediatrics, as well as nutrition and social determinants of health. So I help out with our Food is Health program at Riverside Family Medicine and do a lot of inpatient teaching as well as precept and still see my own patients. So look forward to connecting with you.
Hi, I'm Dr. LaQuesta, or if you've been to SNMA RMEC or AMEC, you may know me as Dr. L. I'm one of the faculty members that precepts. I do ambulatory, I do inpatient and newborn medicine, and I love behavioral health and derm procedures. I also help create professional development plans for residents who are looking to work on specific skills that they'd like to target. And I also direct the longitudinal leadership curriculum, and I really enjoy seeing how our residents grow in their leadership skills over the time that they're with us in 3 years. I also have a role in system medical education in diversity and inclusion, and I just really love working for a place that has inclusion as a core value, and we strive to be a place where everyone feels valued and feels that they can bring their whole selves to work. I really am proud to work for a place that does everything that they can to provide learners with all the resources that they need in order to reach their fullest potential. I'm also the director of the Ohio Health Physician Diversity Scholars Program, which is a mentoring program for students, medical students who are underrepresented in medicine. We pair those students with the physician mentors within Ohio Health with a mission to create pathways leading to a physician community that reflects the rich diversity of those we serve. As a resident, you'd also have an opportunity to participate in the mentoring program and also have access to all of the professional development, leadership, and support that the Diversity Scholars Program has. I also am an implicit bias trainer, and I'm really excited to be part of the AAFP faculty for the National Board Review course. I'm so excited that you're here to learn more about Riverside, and I hope to meet you in person soon.
Hi, everybody. I'm Dr. Jen Middleton. I'm one of the associate program directors here. So as you can see from my slide, I like all things nerdy, so I was involved for several years, and I still help out with the evidence-based medicine curriculum. I also do a lot of work with residents around scholarly activity, and I help lead our scholarly activity and population health curriculum, or what we call SAF. So all of our residents have the opportunity through this structured 3-year curriculum to complete a scholarly activity project on the population of their choice and working with that population to do an intervention to help improve some piece of their overall health. Definitely be sure to ask our residents about the SAF projects that they are working on. You will hear about some really amazing things. But we're really proud of that curriculum. We have protected time every block, along with a lot of worksheets and faculty guidance to help you succeed at completing your scholarly activity. I also am one of our Suboxone providers here in the office, and so I do most of the Tuesday morning medication-assisted treatment clinics here. And one of my favorite things is the academic medicine elective, which we do every fall for any residents, senior residents who are interested potentially in an academic medicine career. So what is that all about, and what does that look like? I am also one of American Family Physician's contributing editors, so all things writing and editing I love to help people with. And I was formerly a board member on the Family Medicine Education Consortium, and now I am serving as their faculty development advisor. So it's really great to have a connection to that national leadership group here at the program. But thanks so much for checking us out. Please be sure to reach out if there are any questions I can answer about any of the things that I specifically help out with here, and have a great rest of your day.
Dr. Hintz is our clinical pharmacist. She also assists with resident education and really coordinates care, in particular for our diabetic and hypertensive patients.
Hi everybody, my name is Ben Ahrens. I'm one of the assistant program directors here at Riverside Family Medicine. I'm part of the sports medicine faculty, and I teach in the osteopathic manipulation and sports medicine clinic 1 day per week. I'm a proud alum of the University of Wisconsin in Madison and the Des Moines University College of Medicine and Health Sciences. I did my family medicine residency here in this program and finished in 2017. I then finished my sports medicine fellowship through Riverside in 2018. I'm now one of the team physicians at Ohio Wesleyan University, and I have a family medicine and sports medicine clinic here in Hilliard, Ohio. Some of my interests are osteopathic manipulation, sports medicine, and other musculoskeletal procedures, as well as all Wisconsin sports, of course. So go Pack Go, and I look forward to working with all of you.
Dr. Rangaswamy is our geriatrician. Our residents work with her both at our geriatric assessment clinic here at the Riverside Family Practice Center and also at the Arlington Court Nursing Home, where our residents provide care for our longitudinal continuity patients there. Kelsey Sicker is a program graduate of Riverside Family Medicine in 2022, and we were thrilled to be able to keep her on 1 day a week to continue to perform acupuncture here at the program. So she will be working with residents who want to get an exposure to acupuncture and integrative medicine here at Riverside Family Medicine. Dr. David Stockwell, though trained as an OB/GYN, is truly a family doctor at heart, and he staffs our women's health procedure clinic on Tuesday mornings.
Hi, my name's Allison Lemkool. I'm the outpatient dietitian and faculty member here at Riverside Family Practice Center. I completed my undergraduate degree at Ohio University in nutrition and dietetics. I then went on to complete my master's degree at Eastern Illinois University in nutrition education and dietetics, where I also had my dietetic internship completed. Some of the roles I have in this clinic are for clinical consults and ambulatory nutrition services. I am a nutrition educator for the medical education program. I also serve in some of the community medicine rotations for Food is Health. I'm a part of the high-risk care management team. Some of my interests within family medicine for our program include diabetes, gastrointestinal diseases, cardiovascular disease, really improving upon the continuity of care between our patients and us, weight management, malnutrition, and more. I really want to serve as a resource for all of my other faculty members, patients, and the community. So if you have any questions on nutrition, please let me know. I really want to serve as a resource for you all. Thank you. Have a great rest of your day.
In addition, we have a wide variety of adjunct faculty and community preceptors that work in many settings, including private practice and urgent care. These faculty will give you an additional experience in the preceptor room outside of our core faculty and part-time faculty. Thanks for taking a few minutes to learn a little bit more about our faculty here at Riverside Family Medicine. A video will absolutely not do justice to the people that we have in this building. We absolutely have an amazing group of faculty that are so supportive of our residents and absolutely love teaching. So I hope you get to meet a lot of them during your interview day, but if there's any that you want to interact with that you don't have the opportunity to meet on your interview day, please let me know and I will make sure I connect them with you. Thank you.